Thank you, Mr. Chair and members. AB 1315 is a potential game changer for mental health care in our state. AB 1315 seeks to greatly expand resources for early detection of psychosis and other symptoms of serious mental illness in young people in California, and to respond with evidence-based intervention and treatments that help stem conditions such as schizophrenia, bipolar disorder, and other mood disorders before they become disabling. We actually know how to do this. The research and treatment models are proven and they exist. But not every county has adopted these strategies, and not enough of our young people have access to programs. The bill would set up a public-private partnership that provides funding incentives for counties to focus significant resources on early detection of psychosis and prevention of full-blown mental illness. That's a major shift from the current system, in which the bulk of our spending goes toward dealing with people after mental illness has derailed their lives. AB 1315 would create a special account dedicated to funding programs proven to be effective in early detection and treatment of psychosis and other early markers of serious mental illness. The fund would be fully supported by private donations and federal, state, and private grants.
In the big picture, what we are trying to do here is we are trying to redirect, re-emphasize more mental health funding for prevention and early intervention. All of us in big cities that are small cities that are dealing with the homeless problem know that we must do everything we can to make it better, but in my view, we're never going to catch our own tail here. The only answer in the end is to help people before they have that proverbial first break and begin that cycle that often leads to jail and homelessness and other life-altering consequences.
The bill would also create an expert advisory committee within the Mental Health Services Oversight and Accountability Commission that would be charged with developing guidelines and recommendations for early psychosis programs and implementation that the grants should fund. The grants would be awarded on a competitive basis by the Oversight and Accountability Commission to counties seeking to implement proven early prevention and intervention programs. The advisory committee would also provide ongoing guidance to counties on best practices. Any county that receives an award would have to provide matching funding, which could be diverted from their current MHSA funding or any other source of funding appropriate for these purposes.